Hi, good afternoon, everybody. This is Dr. Heather Stanley Christian. We have a special guest today, Dr. T. Wynn, and I'm going to let her tell a little bit about herself. But just to introduce her, she's the CEO of Pacific Point Podiatry in California, and she also runs a business as a coaching business. Uh, my listeners and my viewers may be wondering why we're doing podiatry, but we never talk about feet in pregnancy. And I do know that we have some changes. So I am going to allow Dr. T Wynn to say hello and tell us a little bit about yourself, Dr. T.
Thanks for having me, Dr. Heather.
No
I
problem.
am Dr. T, and I love feet. And the fact that we don't talk enough about it means I will still have a job for days to come. So
Right.
I take that as a good thing. That means there's a lot of work to do because I certainly love talking about foot health. Feet are underrated, it's underappreciated. And I specialize in limb preservation. So I work with people who are considered high risk for a leg amputation. And people may not recognize this, but if you have diabetes, even if you're developing gestational diabetes, that can put you at risk for damaging other parts of your body, like the nerves and the vessels. And that can lead to really bad consequences if we're not aware about our feet. So I actually love talking about limb preservation or amputation prevention. And all of that really comes from knowing what proper foot health is. And it's something as easy as just being aware of your feet. Now, I know it's different if you're pregnant and you can't even bend over or see past your belly to know what's going on with your feet. So
This is
I
true.
love, happy
This
to
is
talk about
true.
that.
So let us jump off on that limb preservation. In high risk pregnancies, the most common comorbidity that we see in pregnancy is diabetes. Now, fortunately, because a lot of our ladies are young, the diagnosis is relatively made early. But let me ask you this. How soon can a woman, pregnant or not, early in life, see complications arising from the feet?
I've seen people as young as in their 30s develop complications from diabetes, whether it's type 1 or type 2. With pregnancy, because it is reversible after birth, there is still a small percentage of people who maintain that diabetes status. So they have to constantly monitor for the rest of their lives. And I have family members who developed it in their pregnancy and they're
Oh,
diabetic for life. So we just have to be a little bit more aware. The circumstances are very different with pregnancies, but we often think in our 20s and 30s we're invincible, that we can heal whatever cuts we get, not realizing that our body metabolic demands change with every decade. So as I'm hitting into my 40s, my body is feeling it now.
okay. And what should our ladies look out for to say either to their primary care doctor or to their high risk doctor, such as myself, what should they be looking out for? Because I will admit to you, I will be doing everything else, but once in a while, I'll remember to do a foot check. So, what question or what symptom should a patient bring to their doctor's attention for referral to a podiatrist such as yourself?
Sometimes a patient might complain about their legs swelling
Oh,
asymmetrically. So it's like one leg is swollen, not both. You know, in
oh,
pregnancy, you expect things to be symmetrical. If
correct.
it's one-sided, we worry about blood clots starting in the leg, for example.
Okay.
We even worry about undiagnosed cellulitis or infection because if the person is developing diabetes, they may not know they're also developing neuropathy, which is nerve damage. They may not feel problems arising in their feet. So I think a really good thing to just ask your doctor is, do you see anything unusual with my feet on the outside?
Hmm.
What I normally see in pregnant people are ingrown toenails. When your feet get swollen, your feet are squished inside, shoes that you didn't really accommodate for, and it can cause an ingrown toenail. And when you have this big belly to like lean over, it gets more and more difficult the more pregnant we get. And so that's when I've seen pregnancy rely on podiatrists to do something as minor as an ingrown toenail rather than you doing it yourself, creating an infection, causing pain, causing cramps. That's where podiatrists can really help with your foot care.
Okay. That is that was informative for me. So I need to do a better job. I ask about everything else, but admittedly, I think in my headspace, oh, they're young, so it's going to take some time. But even the simple things as a leg swelling, which is a common sign in pregnancy. Um, so let's pivot a little bit and let's talk about pregnancy and changes in the foot. What are the common things? I know when I was pregnant, my I went up in my shoe size. So is that a common thing? And if it is that a reversible thing? Can we talk a little bit about that, please?
I was pregnant 4 years ago, and I remember distinctly being annoyed that my shoe size changed. Luckily, I live in Santa Cruz. It's a beachy town. We're allowed to wear flip-flops year round.
Yeah.
So, yes, your feet does change with pregnancy, and that's because of the swelling that we have for carrying so much weight. We're carrying weights like in 50 pounds and 80 pounds. That's like a whole nother human being. So,
That's true.
you are expected to have changes in your feet, especially swelling. And once that pregnancy passes and your body starts to recognize itself again, the fluid passes and your diet resumes back to normal, your feet does go down in size. Some people do maintain a bigger shoe size for various reasons, but for the most part, it'll come back down.
Okay. Is there any one thing or two things that we could do to help with the reduction in the shoe size?
I think we should embrace how our body changes with age. I mean, we want to be so refined and so specific in our sizes, even in our shoe size, that you forget that you're creating a magical being and your body's going to accommodate that. And it's totally okay to go up a size. Some things that we can do to make ourselves feel comfortable is elevating our legs at the end of the day, for example.
Okay.
But you're going to be the size that you are as your body needs it to grow a whole human being.
That's true. And then you're going to need those feet to run after that whole human being. For
Yeah, for
sure.
18 years or so. That's right.
And to try and kick them out when they refuse to go. Well, very good. And my last question is toenail fungus and that interdigital fungus. Is that worse in pregnancy? Is that a common thing in a non-pregnant state? Can we talk a little bit about that?
Yeah, I don't see it to be a specific thing in pregnancy. Anytime your feet are crushed inside of socks and shoes all day without breathing time, you're
Mm-hmm.
going to increase the risk of developing athlete's foot. And that can show up with itchiness sporadically. It can happen between the toes. You may even also see some of the skin peeling away if it's a chronic problem. So some easy treatments for that is first pay attention to your feet. Are they sweating more? Maybe in pregnancy you realize your feet are sweating more, your metabolism changes.
Mm-hmm.
So if your feet are sweating more, it's retaining a lot of moisture that makes it an environment for fungus to grow. So you'll want to control that sweating with maybe a foot powder that you can easily get at the drugstore or wear open toe shoes when it's permissible. And just making sure that either if you can't reach your foot, have someone else do the kind thing to give you a foot massage and dry between your toes as well, just to just to have regular maintenance so you're not pushing off something that could be very serious, like an open sore or callus developing, and then you have to deal with the long-term problems of that. So
Yeah.
basic awareness, basic care goes a long, long way.
Great. So thank you so much, Dr. T. And where can people find you? Should they be more interested in some foot cares? I know you're in California, I'm in Florida, but the digital world makes the world very small. So please give us a little plug as to where you are.
The best way to find me is on Instagram. It's Dr. T Podiatry. That's DrTeaPodiatry. If you can't remember that, my website is super easy. It's 831feet.com. 831 is the area code for Santa Cruz and Monterey County.
Nice. Dr. T, we appreciate your expertise. I appreciate your expertise because now I have a distal extremity that I am motivated to pay a little bit more attention to. And we thank you for your expertise, and you have a wonderful afternoon.
Thank you. You
Here
too.
in
You have a wonderful evening, coast to
You
coast, huh?
too. Take care.
Take
And
care.
and this is Dr. Heather Stanley Christian from Unity Maternal Fetal Medicine. Our brick and mortar house is in Claremont, Florida, Unity Maternal Fetal Medicine on Facebook, Unity MFM on Insta. Stay tuned and have a curious day.